For those of you just joining in, welcome to the Food as Medicine Summit. Next up, strategies for food as medicine policy.
For those just joining, we welcome you to our next panel, Strategies for Food as Medicine Policy. I couldn't be more honored to share the virtual stage with our three panelists today. Please welcome Dr. Brenda Ayers from Nuvance Health, Congressman Jim McGovern from Massachusetts, and Executive Director Natasha Pernicka, who is from the food pantries of the Capital District, and more. Welcome, everybody. So we're going to start off with Congressman McGovern here. Congratulations, first off. I see we got a stopgap spending bill passed yesterday in the House, right? Averting a shutdown. Thank you.
Yeah, the government won't shut down for a few months, at least. Hopefully.
We'd love to hear it. We'd love to hear it. You've been serving in the House of Representatives since 1996 with a leadership role in the Rules Committee. You also serve on the House Committee on Agriculture. And through your advocacy, military families are now being screened for hunger. Schools are able to provide more nutritious meals. And America has a plan to end hunger within the decade. Talk about some current legislation, either on the national stage or more local, maybe on the state level, that underscores a dedication to nutritional welfare. As part of your answer, please talk a little bit, too, about how the Farm Bill has an impact on food as medicine initiatives.
Well, thank you for having me, and thank you for doing this. We're just getting started, I'll soon reintroduce my bipartisan, bicameral, medically tailored meals bill to establish a national pilot program to expand medically tailored meals throughout the country. I just had a meeting about an hour ago with the head of CMS talking about actions I think they should be taking on this topic. And with regard to the Farm Bill, I mean, I think we need to make sure that we protect the recent update to the Thrifty Food Plan, which is the calculation that determines how much people receive in SNAP. SNAP benefits, as you all know, are already way too low. It's about, on average, of about $2 per person per meal. Any further cuts would make it that much harder for people to purchase not just healthy food, but food in general. We need to increase and expand GusSNP, which is the program that provides additional money to purchase fresh fruits and vegetables, which has been a great success. We need to increase funding for SNAP education and nutrition education in schools. Making lessons about healthy food fun and engaging is a great way to foster healthy habits, and students bring these lessons back home to their families. If I had my way, I would be encouraging schools to teach nutrition and basic home economics, as they used to call it. I mean, I took algebra. I'm not trying to berate the importance of algebra, but I still don't know what it did for me. But nonetheless, being able to give young people the skills to know what is good for them and to also be able to prepare meals, I think is something that will last with them for a lifetime. The other thing is we are working state by state to make school meals universal and free and nutritious for everybody. We're working with USDA to deal with the issue of community eligibility so that more schools can get covered with federal funds. So those are just a few of the things that we're looking at. But that White House conference on hunger, nutrition, and health helped put out a lot of good ideas that people are trying to build on, and so we have a lot more to do.
That's really terrific to hear. And I attended that conference, and I've been, attending the listening sessions since. And it's really, encouraging for sure to have, these programs being worked on across the board.
And I would just say one other thing, and that is it's up to all of us who care about this issue to keep the pressure on our elected officials and on the White House. Hunger, when all is said and done, is a political condition. This is a solvable problem. But we need to make sure that our elected officials understand that it's an urgent matter and we need to push them.
For sure, for sure. I'm going to switch over to Dr. Ayers now. You've been a trailblazer as the inaugural medical director of health equity at Nuvance Health. Can you kind of outline for us some of the most effective ways to bring an equity lens to the table in the food as medicine policy arena?
Oh, I love the question, and thank you for this opportunity to be on this esteemed panel. I am truly honored. So I always like to think in terms of data, and we can dispute anecdotes, but it becomes very, very difficult to dispute solid data. And we have data that show that 6 out of 10 Americans in this country are living with at least one chronic condition like hypertension or diabetes. And many, if not most of these conditions, are nutrition sensitive. And this means that the outcomes of these diseases are affected by what we eat, right? So when we look at the statistics on which populations are most affected by many of these chronic conditions, unsurprisingly, they tend to fall disproportionately along racial, ethnic, geographical, socioeconomic lines. And when we understand that the chronic diseases are responsible for 90% of our country's multi-trillion-dollar annual healthcare costs, the math actually becomes really, really simple. So looking through the lens of equity becomes necessary in order to understand what the most impactful ways of affecting these outcomes and cutting costs are for these conditions. And so for me, it follows that our policies addressing nutrition as a treatment for chronic disease, policies such as federal funding that Congressman McGovern was mentioning to support food as medicine programs, or policies that incentivize and promote collaboration between healthcare systems and community-based organizations, or policies that expand these programs beyond Medicaid and some Medicare plans into the commercial payers. These are the policies that will require us to look through the lens of health equity to be most effective. And what the studies also have shown us is that when you focus on equity, the outcomes improve for all. And it truly is, rising tides raise all ships. So that's what I think the way that I tend to look at this through the health equity lens and try to bring the conversation to others.
That's terrific. Thank you for that. Thanks so much. Natasha Pernicka, you, through your work as the executive director for the food pantries of the Capital District and the Alliance for a Hunger-Free New York, and you're also a member of the New York State Council on Hunger and Food Policy. You've been working, really intensely in the realm of food insecurity, for sure. Can you talk a little bit about what you've seen, what you've learned, witnessed, particularly around SNAP benefits, before and after the enhanced benefits were ended, and how access to healthy food has had an impact on overall health of vulnerable populations?
Sure. Thanks so much, Annette. SNAP is our nation's #1 anti-hunger program. And so, yet, while I work with a coalition of food pantries, both in New York's capital region, but also across the state, we're here as a third line of defense. And I just need to throw this in that #1, we believe that living wages are the #1 way to end hunger. #2, it is SNAP. And Congressman McGovern talked about updating the Thrifty Food Plan. However, we, along with FRAC and Feeding America, strongly encourage our federal government to increase to the low-cost food plan in SNAP, which will increase the dollar amount, because we cannot just be feeding people food. It needs to be nutritious food, and we do know that nutritious food is more expensive. And I'm going to preface this with talking about a consumer survey that we did in partnership with Siena College for guests who are visiting food pantries for assistance, because there is some stigma about, or just misunderstanding about, what do people want to eat. People who visit food pantries, people who utilize SNAP, you hear a lot of stories. And when we surveyed consumers at food pantries, the items that they wanted more of were fresh foods, meats, dairy, and fresh fruits and vegetables. So 10 years later, most of the food pantries in our coalition provide fresh fruits and vegetables. Now, going back to your question about SNAP and how that really has impacted our charitable food system through food pantries and food banks, when we were in the COVID times and there were a lot of federal assistance like child tax credits and the emergency SNAP allotments, we saw a significant decrease in the number of people who had to turn to a food pantry. This is important. We would much rather have people shopping at a grocery store like everybody else and having the dignity of choice in choosing the items that they're going to prepare for their own family through a grocery store, instead of having to use the limited supply chain of food banks and food pantries. So SNAP was a critical program to helping families and individuals get by during the COVID crisis. Unfortunately, now that SNAP benefits have been rolled back to pre-COVID rates, and the child tax credit ended, we saw a historic increase in the number of people seeing food pantry assistance. Here in New York's capital region, it went from about 64,000 people pre-pandemic down to 51,000. That's a huge drop because of federal assistance. That was a success. That's what we want to see more of. Now that that's been rolled up, we're back to 70,000 people, and this year we're even 15% higher than last year. So SNAP makes a huge difference.
It sure does. Thank you for that, Natasha. I appreciate it. Back to you, Congressman. Due to your advocacy work, you were really a primary reason why the White House Conference on Hunger, Nutrition, and Health took place last year. And when the 2022 Task Force report was published, what were some of the areas that required the most nuance in order to get enough buy-in from, your congressional colleagues?
Well, I should point out that the White House Domestic Policy Council actually wrote the final report. My job was to try to give them as many ideas and examples of successful, meaningful programs across the country working to end hunger for them to include. And so, I'm probably not the right person to be able to give you a definitive answer on that. My role in this was basically to give them the idea that we ought to do this conference. The last one was in 1969. So we landed somebody on the moon. And that resulted in a lot of important recommendations and a lot of important programs followed that I think made a difference for people. And so, we tried to get this done during the Obama administration. We're not able to. And then we're able to then the Trump administration, I just kind of said, forget about it. And then we went to, we convinced the Biden administration to do it. And we get the congressional funding. We actually appropriated money to do this. Look, part of the reason why I thought this was important is, as I said before, hunger is a political condition. And, you know, when you listen to some of the debates in Congress, or even when I do town halls back home, sometimes people say things that are not accurate in terms of why people are hungry, or even in terms of the benefits that are available to alleviate hunger. So I think we need to set the record straight, and we need to show what's working and what's not working, and what with a little bit more support, you know, can work even better. So I think the importance of this report is that there's something in writing, and there is this, and it's out there basically to say that we can end this. This is a solvable problem. There are lots of issues that we're dealing with right now that I can't tell you what the solution is. But I think all of us on this panel would agree we can solve hunger, right? We can solve hunger. We can deal with the issue of the challenges of lack of nutrition. You know, so, you know, this is about creating the political will to get Congress and state legislatures and local governments and businesses and nonprofits to focus and you know, get this right. You know, Hillary Clinton, you know, used to say it takes a village. She's right, but it also takes a plan for the village to actually try to implement. And so, you know, I think that's the importance of the report. The one final thing I'm going to say too is, you know, one of the things I've been talking more and more about is the cost savings by getting this right. I would like to think that we would all be moved by the fact that there are people in our country, the richest country in the history of the world, who are hungry. You know, I think the moral imperative to do something, to me, is overwhelming. That's not always convincing here in Congress, right? But, you know, there are cost savings to be had if we do this right. And as I said, I was just at a meeting with CMS, and I explained to them that, you know, the number of people who prematurely get who readmitted to hospitals after surgeries, the number one reason why is lack of nutrition. So why aren't we doing medically tailored meals? You know, we talk about people with chronic long-term diseases that could be better managed or reversed in some cases with proper nutrition. Why aren't we focused more on that? You'll save suffering for the individual, but you will save a boatload of money. So, you know, we just have to talk about this in a way that where everybody, you know, no matter which angle they're coming at it from, understand that this is the right thing to do.
Yeah, bravo. Yes. For example, yes. So thank you. I think, Dr. Ayers, I'd like to bring you in on this next area. You know, as a medical professional, you know, and as a doctor, you've been witness to a lot of food as medicine initiatives regionally and nationally that have an expanded reach. And how do you go out and engage and build consensus with your colleagues in tangential areas? Let's say nurses, registered dietitians, lifestyle medicine practitioners, and health coaches. How do you build that coalition?
So I think this is a great question, right? There we go. Do you still see me?
Yeah.
Okay, not sure what happened there. I think this is a really great question. I would say as medical professionals, I think we're trained to understand information in terms of outcomes. And you're going to hear me, if you talk to me, you're going to hear me talk a lot about outcomes. So when I'm speaking to my colleagues, I actually try to bring home the point in terms of outcomes. I think as healthcare professionals, that's what we really care about, right? We want to know that the treatments that we prescribe, the plans that we make for our patients actually result in a change in the condition, the outcome. And certainly, I think across the country, we now have several examples where food as medicine programs have made significant impact on outcomes for chronic diseases like diabetes or hypertension. You can look at Geisinger or Kaiser Permanente and what they're doing with their programs. The food as medicine programs have also been shown to reduce ED visits and readmissions. And these are outcomes that healthcare systems care about. right? Because they're incentivized to care about them. And when what we've shown through these programs is that when people have regular, consistent access to healthy food, we can make a difference. Right? So that's one approach that I take is really tying it back to the outcome in a way that healthcare professionals can understand. The other technique that I will often use sometimes, I think resonates with people, is sharing my own personal experience as well. My lived experience in growing up, I grew up in the Deep South, and there were many occasions where food insecurity was a daily constant for us, where we didn't know where our next meal was going to come from. So I can offer a unique perspective as someone who's lived the experience and understands how the choice between healthy foods and putting gas in the car or keeping the lights on actually is not a choice. So you have no choice in those situations. And now as a physician, I understand the connection between disease and nutrition and how that plays out for vulnerable populations who often don't have the ability to choose to eat vegetables when the dollar menu at McDonald's allows them to eat something at least and keep the lights on.
That's right. Yeah. And especially with busy schedules too. I mean, if someone is working a couple of jobs to make ends meet, you don't always have time at the end of the day to think about meal prep, right?
Right. Right.
So Natasha, in your work in community food, how has that informed your decision to kind of take this leadership role in launching, helping to launch the New York State Food is Medicine project? And when you started out, it was about a year ago, I think, maybe a little more. How did you go about identifying who was included in that process? And, speak a little bit about the importance of collaboration and really bringing all these people to the table in this work.
What brought the food pantries for the Capital District to the Food as Medicine world was the 1115 waiver disrupt here in New York State, where food was a part of the social care interventions. And as a coalition of food pantries, the first thing that I thought of is that food prescriptions should be as easy to access as a pharmacy. There's pharmacies on many corners, and I thought it should be easy. People shouldn't have to go to like a food pharmacy at a hospital in order to get the food. It should be in their own communities. And since we already had a coalition of food pantries across the region, we worked with our local care system on a concept for having medically tailored groceries, a cohort of organizations throughout the region, as well as medically tailored meals. And home delivery was absolutely critical because there are so many people that cannot get to a brick and mortar for so many reasons. So we launched our network approach to food as medicine solution in 2020, which was a great year to start something new, but we did get it done. And then we went through Disrupt and we found that as a vendor, as a part of the 1115 waiver, the way it was set up as a vendor in the social care intervention, we didn't have a lot of control over the funding or the program design, which was counter to what we had gone into it as. And so we felt, we're competing against a lot of other social determinants in, housing, transportation, access to primary care, so many other things. And so we really needed to come together as a food as medicine sector to advocate and develop best practices on the different models, because while medically tailored meals, prepared meals, has